purpose of the research department is to help people learn. We use systematic methods so that we can be really confident in what we're learning, and of course what we want to learn about is how to better understand mental health problems, how better to treat mental health problems, because we want to improve the quality of our services, improve and enhance the experience of our patients. So learning, but in a particular way.
Research can offer our service users time to speak about their experiences so that we can learn more about mental health and the effectiveness of the services that we provide. So it's really good to hear from service users about the good, the bad and the ugly of all of their experiences, so that we can gain a much clearer understanding of what it is that we need to be doing.
The research visits can be really varied depending on what the project is looking at. So pretty much every research study will really want to find out about the person's experience and what it's like to live with the mental health difficulties that they've experienced.
When we went to see the psychiatrist who initially diagnosed Alzheimer's in my wife, he suggested that we might be interested in being involved in a drugs trial. And she readily agreed to it. Early on it wasn't too bad. Because she could walk, she could contribute in conversations. But she's now passed away, but in the last 6 months, she could hardly walk. She couldn't communicate in any reasonable form. She used to wake up 5 or 6 times a night. I wasn't Bryan anymore, I was Gary. I don't know where Gary came from, but my name was Gary, and called it to her. But the main effect was everything you planned to do had to revolve around her condition. So that our social life was virtually nil.
So at the DIU we conduct both commercial studies, which are international drug studies and involve taking a drug. That means that you might take the actual medication that's being experimented, or you might take a placebo.
One of the major projects I've been involved in is Time for Dementia, whereby 2 medical students, 2 doctors at the university, came 2 or 3 times a year to interview us here and see for themselves what it's like to live with dementia. And they found it extremely useful. Rather than just sitting in the classroom learning the theory about dementia, they actually could see it in practice.
The research study that I'm involved in is called the Caring for Caregivers study, or C4C. So as part of the study, we are recruiting carers who are looking after somebody with psychosis, and we are trying to see how a positive writing therapy, which is the positive written disclosure, how that helps them enhance their psychological well-being. What we're trying to see is whether thinking about the positive resources in their lives helps them to manage stress or crisis better in their lives.
The actual measures themselves can vary quite a lot in terms of, we could do some physical tests with people, so we can take kind of like blood pressure, pulse rates. Occasionally we might ask to take a blood sample if the project asks for that. Sometimes we might do some slightly different tasks, like remembering different words or copying different patterns or things like that, so it can be really varied.
The research project that I'm involved in is called Enrich. It's a peer support intervention for people who've been discharged from inpatient services here in Sussex. It's a really exciting study. One of the things that we like to boast about the study is that it's the first co-produced RCT, or randomised control trial, in the world, we believe. And of course that's an amazing thing, because it means that service users are involved in the planning, the delivery, and eventually the evaluation of the research itself.
I started self-harming when I was 13, so 16 years ago, and then I've had depression, anxiety, and an eating disorder since I was about 17. The research that I was involved in, looking at attitudes and stigma towards mental health in emergency services, that has the potential to really affect how emergency services respond in crisis, which is such a worthwhile thing. It's just it's so important to learn about mental health, but what helps it as well.
I first experienced difficulties with my mental health when I was about 18. I used to get really bad bouts of depression. They would go after weeks. So with medication I could carry on. It wasn't until my 30s that I actually started getting worse, and I started hearing voices and seeing things, and in the end I couldn't work, so I had to give up my job. It's very scary as well when you hear voices. In fact, I didn't tell anyone about it for quite a while because I was frightened of what was going to happen. My diagnosis of treatment-resistant schizophrenia means that the tablets don't always help. I wanted to find other ways of coping with it.
We try and advertise research studies as widely as we can, really. We just want to get the message out there, really, that there's things going on that people can take part in. So, you know, we might put posters up in waiting rooms, put leaflets out. The main way that people hear about research is through their sort of care coordinator or their support worker. But yeah, some people, if they're already a member of the research network, then they might be sent information directly about a research study, in which case they can just call us up and, you know, we can have a bit more of a chat about the study and let them know what it will involve.
How I heard about the different research projects was I was at Arran House waiting to see the doctor, and I saw some posters up on the wall about it, and I took the number and I thought, well, I'll ring up and find out about that, which I did, and I've been able to help in various research projects since then.
We advertise through clinics, through clinical teams, so that would be posters perhaps in waiting rooms and that kind of thing. In the past we have also advertised in newspapers, so people can self-refer if they're interested. We have a lot of engagement with clinical teams as well, directly, with perhaps team managers. We might go to team meetings and talk about what studies we've got on offer currently, and what will happen then is if a clinician believes they have a patient that would be eligible and also interested, they would ask their consent and then refer them to us, and from there then we would contact that patient and sit and take it further, give them further information.
Following on the drugs trial that we were introduced to by the psychiatrist, there was documentation and leaflets and things at Crowborough which indicated that there was a research network which we could join as lay people. We enjoyed our trips to Crowborough. We looked after very well, and she quite enjoyed it, to be honest. Apart from the fact that she asked questions which she couldn't answer. But that was all part of the project.
The first time I was asked, I didn't know it was something that happened. I was just, I was in the eating disorder services, and they asked me at the end of a session if I was interested. And that was the first time I'd ever seen that happen. So I just said yes out of interest because I like research, and went from there, and it was really interesting. So I think because you've always got the option to say no, so you don't have to do it. There's always consent forms and information sheets, so you always know what you're doing. So I've always been comfortable to be asked. It's actually really nice to be asked because it gives you something to sort of focus on, sort of something to look forward to and learn from.
When someone is referred into the study, we'll usually have just a real informal chat with them on the phone to start with, just to find out a bit more about the person and a bit more about their own experiences, because most research studies, you know, they're looking at a specific thing. So usually they ask people to take part who have had a specific experience or have a specific diagnosis around their mental health. So it's really important that we just have a chat to the person, get to know a bit more about them, you know, and just find out like if they're in a position where they could really get involved in a research project.
They're really good at making sure that everyone has a say, even the quieter people. They make sure that you never have to say anything that you're uncomfortable with. You can always change your mind. They just make sure that everyone's comfortable throughout the process, and it's really reassuring.
Quite often what's important to many of our patients is the opportunity to give something back, to help others, to be altruistic, to help develop better understandings of mental health problems, better treatments, so that maybe future generations of people maybe don't struggle as much as they have.
If it helps other people out there that perhaps have similar conditions, then that's great, even if I can just help one person.
Taking part in research on the whole, it offers care, but it also offers the satisfaction that they're making a difference to other people's future as well. And I think people value that.
I didn't feel alone with my problems anymore. I felt that I was helping other people with very similar problems, and that did my confidence good. And as I say, I just didn't feel so alone as when you're sitting at home and you're not feeling well and you just feel so lonely and despairing. But to actually help with a project like this, it just makes your confidence grow and you're helping other people.
I think one of the most humbling experiences in this interaction with carers has been that despite all the stresses and all the struggles that they have in their own lives, they're very altruistic about taking part in research and helping somebody who's in the same position as them. And that just inspires you every day to see how people, despite all these pressures, are still looking to help others in the society. And one of the positive experiences that I've had in this research experience is that I've come across carers who say that they've felt that their views were valued and that they can feel that whatever they share with us is going to help build a better practice in the NHS, which is exactly what we want.
The whole object of research, and it's not just research, it's research and development, is to translate what is happening, what has been looked at in terms of therapy and drugs, into practical help for service users, for people that, and hopefully it'll improve the service that the Trust can give.
It is a real confidence boost, especially because even for service users, we're not just service users, we have other skills as well, we have other roles, so we have previous jobs and we have previous skills, and we can bring those to the research as well. For me, it was a real confidence boost. That I didn't really speak very much before. I have quite bad social anxiety, so I really threw myself into starting to get involved in speaking a lot more. And you get sort of good feedback on what you're doing, and it's a real confidence boost.
Many people are just excited to be involved in research itself, ultimately knowing that being part of a study that could improve people's care in inpatient services that are under increased pressure and under-resourced at times in a really challenging environment, just knowing that people have that enthusiasm for research is some of the most positive experiences I've had.
Research in healthcare it goes hand in hand with delivering compassionate and caring services. So ultimately, it's about getting the best outcomes for our service users. So we need to be assured that the services that we're offering are following, the most up-to-date research knowledge on a real firm evidence base, so that in turn we can give, that level of assurity and confidence to people that use our services.
We really need all the help we can get in terms of understanding this problem. Awareness has grown recently, and like Professor Banerjee says, there's never been a better time to have dementia. There's always more that can be done, not only to find a cure, but also working out the best ways to care for people.
I think it's just such a massively important area. There's so much that we need to learn still about mental health, but not just about mental health, but what helps with mental health and how we can improve mental health. So the good thing I think about the research in health services is that it's really applied. So what you're doing, it's not just theoretical, but it really makes a difference to how services run.
I'm honoured to be a part of this trust, which puts such much emphasis on research.
I think research, engaging in research within Sussex Partnership shouldn't be seen as a luxury or as an add-on to our services, but an integral part of what we do to ensure that we get, the best outcomes for our service users. So in practice, that engaging in research can lead to longer and more sustainable access to therapies and interventions. It can extend, and introduce new medications, or just, I guess, understanding, the experiences of our service users, so that in turn we can understand a lot more about mental health and the effectiveness of the interventions that we provide.
Without research, there's no progress.
You get to see the effects of what you're doing. You get to see how it makes a difference, and that's really nice.
It's brilliant.